Hi, I'm David Powell. I'm an ENT and facial plastic surgeon, and today we're talking about Botox. I just wanted to educate people about what Botox is and explain some common misperceptions and answer questions about this product, because it's probably one of the most popular topics that comes up with people who visit my clinic. Botox is a protein that is derived from Clostridium botulinum, which is a bacteria. It's a very potent toxin that's harvested from these bacteria, and then it's diluted into tiny amounts that are then used for medical use. So what the public sees is a vial that has a medicine in it that looks like water, and it has tiny, tiny amounts of this botulinum toxin that are then injected. I also want to say that Botox is a trade name for one of the products. There are actually several products that are called botulinum toxin, and Botox has become almost synonymous with that product. So most people know of the product as Botox, even though there are other products that have the same chemical compound. Probably the most common question that we get asked is, does it hurt? And the answer is not really. It does involve a needle, and we have to inject tiny little amounts of this fluid under the skin. And so there's a little bit of a stick from the needle, but the needle is tiny. It's one of the tiniest needles that they make. It's a 30 gauge needle, and so it really doesn't hurt very much. If it does hurt, it's just for a few seconds. Botox usually lasts about 3 to 4 months when it's used for cosmetic uses. When Botox is used for cosmetic purposes, it's usually used to treat areas in the upper face, around the eyes, between the eyes, and in the forehead area to reduce muscular activity and thereby reduce the wrinkling of the overlying skin. The way that Botox works is that it blocks the neuromuscular junction of the muscle, and so therefore it can reduce muscular activity, and thereby the skin overlying the muscle doesn't wrinkle when the patient tries to make facial expressions. So when it's used correctly, the patient can still make normal facial expressions, but they're going to be muted or suppressed somewhat, so they're not as exaggerated, and therefore the skin over the muscle won't wrinkle as much. The most common area that it's injected is between the eyes to get rid of the frown lines. Another common area is the crow's feet area on the side of the eye. Those are two very popular areas. And then a third popular area is the forehead. Botox can be used to raise the eyebrows slightly so that can be done with a chemical treatment, an injection instead of surgery. So that's an attractive option for people that want to have brow elevation. The answer is yes. But in my hands, when I use Botox, I inject it into the exact area that I want it to stay. So the only caveat is I tell patients, don't rub or massage the injected areas for a day or two so that the medicine has a chance to be absorbed into the muscle that I'm trying to treat. For cosmetic treatments, it is never covered by insurance, and the usual out-of-pocket cost would be anywhere from probably around $200 to maybe as high as $500. Those are, in general, that's where 90% of the charges would fall. The charges increase the more areas that are treated for the patient. At Ohio ENT and Allergy Physicians, a board-certified physician does the procedure. It is a true medical procedure with a real drug, and therefore it is performed by a physician. It is not delegated. The most common side effect is that it may lead to a bruise, and that is because it is injected with a needle. The needle is tiny, and I try very hard to avoid blood vessels, but some blood vessels are so tiny they can't be seen, and so they can get nicked by the little needle when you insert it into the skin, and therefore it's very common to have some bruising in some of the injected areas. The bruising tends to look like a little blue mark in the vicinity of the needle, and it is usually very easy to conceal with makeup. If you do get a bruise, it usually only lasts for a few days. It's a minor side effect that some patients report. Most patients have told me that the bruising is so insignificant that it doesn't prohibit them from getting it again. It doesn't seem to be something that bothers people enough so that they would avoid doing it again. There are some warnings about the product. It can, if the medicine is injected wrong, or if the patient disperses the medication by rubbing it, then the medicine can get into the wrong muscle and have an unexpected side effect. The most famous one is droopy eyelids. Now, if that happens, which is very rare, if that happens, it can be treated with an eye drop that reverses the effect. And if you remember, the effects of Botox only last for 3 to 4 months anyway. So if you do have one of these abnormal reactions, it's easily treated and reversible. Having said that, this is a very rare side effect. It does have some generalized weakness type of symptoms in people that have a known neuromuscular disorder. For instance, myasthenia gravis, which is a rare neuromuscular disorder. So unfortunately, for people that have neuromuscular problems, it's probably not a good idea to get Botox. Another category of patients that we just simply don't know anything about are women who are expecting a baby. If you're expecting, it's a bad idea, in my opinion, to get Botox. Or I should say, it's just unknown what the effects are, so it's probably best to avoid Botox if you're expecting. Another question is, will people need increasing or decreasing doses, and therefore will they be able to save money down the road? And what I've noticed is that for people that do Botox regularly, there does seem to be some ability to control cost, because either the Botox has a slightly longer effect for some people, or the patient gets more and more discriminating about what they want treated and what they don't like treated. So one of the main things that I try to do with Botox patients is have a frank, open conversation with them about what their budget limits are, how much do they want to spend, and are there any areas that they're afraid of having treated, and I try to operate within those parameters. So these decisions about how much to spend and what areas to treat are made jointly between the patient and the physician. So this is a teamwork kind of process.